Mr. Mansell, Moderna recently paid NIH $400 million. Do you believe it creates a conflict of interest for the government employees who are making money now off of the vaccine to also be dictating the policy about how many times we have to take the vaccine?
Good morning, Senator. Indeed, we recently made, before Christmas last year, a $400 million payment to the NIH for an old patent that they had developed, not related to COVID, but useful in the development of a COVID vaccine to pay them for their work. It's for the U.S. government to assess how that money should be used.
Do you think it creates a conflict of interest for the same people deciding the policy of how often we have to take the vaccine to also be making money the more times we take the vaccine? Yes or no?
This is for the government to decide, Senator.
You have no opinion on whether or not it creates a conflict of interest. Is there a higher interest or a higher incidence of myocarditis among adolescent males 16 to 24 after taking your vaccine?
So thank you for the question, Senator. First, let me say we care deeply about safety, and we're working closely with the CDC and the FDA to
Pretty much a yes or no. Is there a higher incidence of myocarditis among boys 16 to 24 after they take your vaccine?
The data I've seen from the CDC actually shown that there's less myocarditis for people who get the vaccine versus who get COVID infection.
You're saying that for ages 16 to 24 among males who take the COVID vaccine, their risk of myocarditis is less than people who get the disease.
That is my understanding,
That
sir.
is not true, and I'd like to enter into the record 6 peer-reviewed papers from the Journal of Vaccine, the Annals of Medicine, that say the complete opposite of what you say. I also spoke with your president just last week, and he readily acknowledged in private that, yes, there is an increased risk of myocarditis. The fact that you can't say it in public is quite disturbing. Do you think it's scientifically sound to mandate 3 vaccines for adolescent boys?
This is for the public health leaders to decide, Senator.
You've been advocating for it. You've been interviewed, and you've been advocating for boosters. Do you know when the myocarditis is most common among these adolescent boys? After the 2nd dose. When I spoke with your president, he readily acknowledged in private, yeah, that maybe there ought to be a discussion whether we ought to have 1 vaccine versus 2 versus 3. If 90% of the myocarditis comes after the 2nd dose, why don't we have a rational discussion about 1? Marty McCary, a physician from Johns Hopkins, has said exactly the same thing. It's been discussed, and yet we have this ridiculous notion from the CDC. So the CDC says, and I'll ask you this question. Let's start it as a question. Your 16-year-old's had COVID. Your 16-year-old gets better and now has recovered from COVID. You vaccinate them, and they get myocarditis. Are you going to give them 2 more vaccines? Your child, give them 2 more vaccines?
I'm not a clinician. I will have to discuss.
You have children.
I do.
Have you vaccinated your children?
I have.
How many times?
3 or 4 times.
3 or 4 times.
We follow
So
this.
the CDC recommends this, and, you know, you're obviously someone who's self-interested in the outcome here. But the CDC says that if your 15, 16-year-old gets COVID, recovers, takes a vaccine and gets myocarditis, is hospitalized with elevated heart enzymes, and is very sick, the CDC says as soon as he gets better, vaccinate him again. You know how many American parents think that that's a rational, reasonable thing to do? Do you know how many countries don't do this for children? Sweden doesn't offer the vaccine for kids under 12 unless they're at risk for severe disease. And I agree with that. I'm not saying never on any of this. I think it's a very reasonable position to say kids at risk or have some diseases that there may be a reason for vaccinating some children. Finland doesn't recommend it for under 12 months. Norway also. England as well. France, Poland, Germany, Switzerland, and all vaccinate 12 and up. So we got half the world who have looked at these studies. There's a study in Israel of thousands of patients, and yet you sit here and act as if you've never heard of myocarditis, and you don't think it's an increased risk for young adolescent males, when all of the studies who isolate out people by age have found that, yes, there's an increased risk after taking your vaccine. Pfizer, too, but worse with Moderna.
There's an increased risk, Senator. I was comparing it to somebody who gets COVID.
Well, that's also not true either. But there's an increased risk of getting it. But even when they compare it to the disease, there are many papers out there that do show that there's more of a risk of myocarditis after vaccination. So you have to weigh the risk and balances. And you are right, you're going to make less money because You're going to try, and they're already trying. The CDC's got it on their schedule. They're going to try to force all the kids in America to do this through school. But guess what? Parents aren't going to do it. They've seen that COVID is not deadly in children, and you're right. It's become less deadly over time. Your market's going down, so you aren't going to make as much money. I'm all for you making money in an honest way, but I don't like the idea that the people making the decisions in government are also receiving money and are now conflicted in their interest.
Thank you, Senator Paul. Senator Casey.
Mr. Chairman, thanks very much, Mr. Bancel. Great to be with you, and thanks for your testimony. I wanted to get right to the heart of the matter that we're exploring today, among other issues, and that's the question of price. But I wanted to start with, by way of a predicate, that we're certainly grateful for the work of Moderna and the other companies working in concert with the federal government, both federal appropriations as well as agencies like NIH and others, to develop these vaccines in short order and to be able to provide the benefit, as you outlined in your testimony, to save millions of lives. And we're grateful for that. We're also grateful for the ongoing work that is done every day to save lives. I wanted to explore, though, this question of this partnership between not only Moderna but other entities and the federal government. You might call it a public-private partnership. I would argue that that partnership, which yielded such great benefits for our country and the world, should not be extinguished because the pandemic is over. I would argue there are ongoing obligations and I think even practical reasons to continue that kind of partnership, maybe in a different form, maybe with different outcomes and different dynamics, as you've outlined on page 9 of your testimony, when you go from the earlier version of a partnership to commercial application of the vaccine. But I'd ask you this, and I noted in your testimony on page 1, you said in the second paragraph about the Jesuit teachings. I went to a Jesuit high school and college, so I'm somewhat familiar with these teachings. You said, quote, Jesuit values the continuous pursuit of excellence, service of the greater good, number 2, and third, social responsibility, you say have informed my life and leadership of Moderna, unquote. So I want to juxtapose those values, which I think are commendable, and I think we hope they're American values as well, next to this, what I would argue is an ongoing obligation to have this partnership. Shouldn't there be an ongoing obligation with regard to a product that was developed in partnership with the federal government to ensure that it remains both inexpensive and accessible? Don't you believe that that is your obligation and Moderna's obligation?
Thank you, Senator, and good morning. So, first, thank you for the kind words that you shared about our teams and all the other companies and the government personnel who has helped fight this pandemic. So, first on access, as I shared in my testimony and in a written one, we care deeply about access, and we're working hard with our team, and I'm happy to spend more time on that topic. I know it's important for the chairman as well, to make sure that people that are uninsured or underinsured have access to the vaccine. We want to make sure that cost and out-of-pocket cash is not a barrier to access to vaccine. Then on the topic of price, it's important as we move into the endemic market that we price to value of a vaccine. What value does it bring in terms of healthcare dollars? As you know, vaccines are one of the best investments we can make with healthcare dollars in terms of a return. This has been documented for many, many years, because it's better to prevent disease than to have to pay the cost of somebody being hospitalized, and that's very expensive cost, without even adding the economic burden, obviously. So that's really important. If you look at the interesting comparator is flu. The CVS price of a high-dose flu vaccine used for the elderly is around $95 in this country. If you look at COVID, there are 2 to 3 times more hospitalization right now of COVID. So when you look at the price in that range, seems to make sense versus the value that have been assigned already to flu over the years. And you can look at other vaccines like pneumonia. The CVS price of pneumonia vaccine is around $250.
Well, I'd ask you this, just by way of follow-up, and I realize that you're making that comparison with flu vaccine, but for a lot of my constituents, most of my constituents, no matter what their insurance status is, The cost of prescription drugs is like a bag of rocks on their shoulder every single day. And what may not seem like a lot of money to you or a lot of other people, $130, $150, or whatever the number ends up, is a lot of money. And I'd ask you, and I'll ask you for the record in writing, to ensure that anyone can get a vaccine. They won't have to apply through some tedious process and then wait for approval, or apply for some kind of reimbursement or have to drive a long distance. That, I believe, is your obligation as a company. And I know I'm out of time, but we'll ask that in writing. Thank you.
Now, you can answer that, Mr. Bancel, if you'd like.
Yes, and I'm happy to spend time later on the topic. On the access program, we want to make sure we have a simple program that is in multi-language. We're also trying to learn from what is not working from current programs done by larger companies. So, for example, we want to make sure we can partner with rural community hospital, potentially homeless shelters, to make it much easier. So I'm happy to spend more time on that topic. It's very important.
Senator Cassidy.